What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. As you all know, that I'm always trying to improve my channel, and I ask you guys all the time, like, what can I do to improve my channel? What videos do you want to see? Who should I interview? So I'm always trying to do things to help you guys, and always trying to do things to improve the channel. So one of the things was that I asked, and people wanted to see more of, is day in the life videos. So what I decided to do was interview or allow other people to show their day in the life. Not only me as an orthopedic surgeon, but med students, PAs, nurses, physical therapists. So I'm trying to get other individuals to show what it's like in their particular day, like what goes on, what does their day consist of. So first up, I have a day in life video of Lieutenant Quinn. She's a military ICU nurse. And if you haven't already checked out her previous interview where we talked about military nursing versus civilian nursing and why she went into nursing, check that out here. But you guys are gonna hang out with her today and see what it's like to be a military nurse and work in the ICU. So she's gonna tell you all about that. But thank you guys for watching this. Make sure you subscribe and also visit my sponsors of this video over at disabilityquotes.com. They help physicians, they help residents, they help med students, and other professionals find disability insurance to replace income when you're sick or when you cannot work. It's extremely important. I cannot highly emphasize that enough. If you haven't already gotten the insurance, I think you should definitely get it. I have an interview coming up where I'll talk about why it's important and why it was applicable the other day in surgery. So definitely look out for that video. Enjoy today, Lieutenant Quinn. She's going to tell you all about military nursing, and you guys are going to hang out with her today. If you or someone you may know would be interested in doing a day in a life video for me, please email me at overcomingtheoddsbook@gmail.com or comment in the description below. I look forward to hearing from you guys.
Hi guys, good morning. Thank you for joining me. So my name is Jay, and as you guys can see, it is a little bit after 5 now. I have already gotten ready, and I'm going to show you guys what a day in the life of a military nurse is like. So as you can see, I'm in my bathroom because I'm going to finish getting ready for work, and then we are going to head out. So I hope you guys enjoy. so I have made it to work. I am currently in the parking lot, which is where I park before I go inside. I just like to sit here for a couple minutes, gather up my things, which I have sitting here next to me. So I will go in, and it is actually Saturday, so I'm on that weekend flow, and I will be here for 12 hours. It is currently 5:37, so we have different start times here than typical hospitals. So we do a 5:45 to 5:45, so that's 5:45 a.m. to 5:45 p.m. Or vice versa for night shift. So like I said, my name is Jay. I am a second lieutenant in the U.S. Air Force. I am a member of the Nurse Corps. I am a critical care nurse, so I do work here in this hospital in the ICU. So yeah, the plan is for me to just show you the day. Of course, I will not do any filming inside the hospital. So when I come out today, I will talk to you guys about the shift. Any of you guys watching, I don't know if you follow me personally on my channel. Just to give you a quick rundown, my particular hospital is small, it's 6 beds. We don't get a lot of ICU patients. A lot of our patients sometimes are more med-surg, but they come to our side just for a little closer monitoring, maybe for respiratory issues, if they're on insulin drips, or anything that our med-surg nurses don't feel comfortable with. And I do the air quotes because a lot of times the certified med-surg nurses, they just don't feel comfortable because they don't have a lot of outside experience. So that's why these patients are typically your med-surg patients, but they end up on our ICU. And when you think of military in general, when you think of the patient population and the patient status, you just really don't have that sick population that you would out on the civilian side. So yeah, when I go in today, I'll just do my thing, and then when I come out today, I will do a overview of how the day went, and then I'll just kind of go through and continue filming what my day is like for you guys. So I'm going to gather up my things, which I have here next to me. My book bag. So just my book bag is like everyday things that I carry with me. So yeah, I will talk to you guys after my shift. Bye! Hi you guys. So it is now 5:40. I have just left out of the hospital. As you guys can tell, I'm in the car. So if you see like a lot of different shadows across my face and things like that, it's because I have my camera up. And so I am just filming so I can do a little chit chat with you guys. So the day was pretty well. So usually what happens when I go to work, I am one of the nurses that is qualified to be what's called NOD, N-O-D, so that's nurse on duty. So I carry around this little phone, I answer calls that come through on the phone, and just deal with any issues that might arise in the hospital on any of the inpatient units. So that's our med-surg unit, labor and delivery, NICU, yeah, so those units. So I carry around the little phone. I deal with any admissions that come through from the emergency department, any docs that want to call, deal with anything through admissions and dispositions, any of the units that need to call me and let me know, if anything's going on with patients, things like that. So I carry around this little phone with me. I went over to our med-surg floor and helped out a little bit, tried to start an IV in a patient that was a hard stick. Fortunately, I was not able to get it, so we did have someone else that was able to start an IV for that patient. So that's basically what I do as an ICU nurse. So we actually did not have any patients in our ICU today, and that is not uncommon. I don't know how many of you guys have ever watched any of the videos on my channel, and I tell you guys before, sometimes we don't have patients in our ICU because it's just not a critical environment when you're in the Air Force. You think of, healthy, active military members and their dependents. So, they're not going to spend a lot of time in a critical care environment. So that's basically what my day entails. I'm headed now. I'm going to grab dinner. And then once I get dinner, I'm going to take that home. I'm just going to swing by Chick-fil-A because it's not too far from where I stay. I'm going to take that home. and then I'm gonna eat, shower, and get ready for bed because I'll be back on it again tomorrow. So usually our shifts are, of course, 12 hours like a typical nurse, and then we usually work 2 or 3 days a week, and then we kind of rotate and do different weekends. We're also on a Panama schedule, so right now I'm on day shift, and then a couple months from now I'll go back to do night shift. So that's pretty much the same nursing schedule as your civilian ICU experience, for anybody that is wondering. So yeah, I just wanted to sit and kind of do a little chit chat with you guys while I'm in the car driving. And then on top of the days that we do work, we have on-call shifts. Very rarely for ICU do we get called in. It's really only if there are an influx of patients that are coming in or some nurse calls out. And then, of course, we have our monthly staff meetings that take place the last Thursday of every month, which, of course, as a civilian nurse, you guys know, I mean, we have staff meetings on the civilian side as well. So, of course, that's not really anything new either. But other than that, guys, I just wanted to kind of chit-chat, let you guys know kind of what my day was like at work today, since, of course, I couldn't film inside the hospital for you guys. But I am almost at Chick-fil-A. I'm going to pick up my food, and I will do a little chit-chat with you guys right before I go to bed. So I will talk to you guys later. Bye. Alright, guys, so I am getting ready to go to bed so I can repeat and do the same thing tomorrow. So I hope that you guys have enjoyed this video. This was just a day in the life of an ICU Air Force nurse. If you guys have any questions, please feel free to reach out to me. I'm sure all of my information will be listed below. If you guys also have any questions about what it's like to be a nurse in the Air Force, whether it's ICU or just typical process of nursing in general and how to go about that, you do have to have your bachelor's to be a nurse in the military, and you do have to go through the health professions recruiter, not a regular Air Force recruiter. It is a health professions recruiter. You don't have to do basic military training. You do have to go through officer training, and that is a 5.5-week course in Maxwell, at Maxwell Air Force Base in Alabama. So that is something that you do have to go through, and it is different from basic military training. It's more of a college style type atmosphere with lectures and teaching you how to be a commissioned officer. So that's the major difference. And then it's for health professions and those in the JAG program. So yeah, you do have to have at least a bachelor's degree. So those are the major differences. And then, like I said, you'll speak to a health professions recruiter, not just a regular Air Force recruiter. And then specifically for those that might be interested in ICU, just know that the ICU world is very small within the Air Force. There's 6 or 7 bases that actually have the capacity to run an ICU. So just keep that in mind as well. So yeah, hope that you guys have enjoyed a day in the life of an ICU nurse in the Air Force, and I will see you guys around. Bye!